Welcome, everybody, to our 15th anniversary of the 11 Days of Global Unity. This is an exciting time that we get to talk with the experts about the incredible things that are happening in our world. I get to co-host this beautiful series with my dear friend Rick Alphick, who is the founder of We the World and the We campaign. You can find that at we.net. It's a global platform to unite and amplify the efforts of people and organizations and movements working with a common good. Rick is co-creator of the 11 Days of Global Unity, 11 Ways to Change the World, which is linking local awareness and action campaigns into an inspiring international movement with beautiful participants, including Desmond Tutu, Jane Goodall, Marianne Williamson, Deepak Chopra, Bill McKibben, and so many more. Welcome, Rick.
It's great to be on with you, Kathryn, and it's so exciting that we are celebrating the 15th anniversary of 11 Days of Global Unity. And what better way to celebrate than to have our 11 Days of Global Unity TeleSummit on each of the 11 themes. And today, of course, is on health. But I also want to let people know who you are, Kathryn. Our host is Kathryn Palmer, a mom who made a wish that sparked a kindness revolution. She is a global kindness leader and educator, and you can find her at globalkindnesstv.org. Kathryn is a live stream and social media expert who designs musical coloring books and toys to help co-create a kinder world. A best-selling author and co-producer of several popular online talk shows, she helps change agents and peacemakers find their voice and share their message and gifts globally. She is a recording artist of conscious music. So thank you, Kathryn, and thank you all so much for joining us today. You can go ahead and share this video that you're watching with your friends, and you can also make comments during this broadcast. So I want to talk about the 11 campaigns for a moment. We encourage you to check out all of the panels of the 11 Days of Global Unity TeleSummit that are based on the 11 campaigns for change. Together, they form a blueprint for global transformation. And if you go to we.net and you see 11 ways to transform your world, there you will find the 11 campaigns, and you and your organization can get directly involved and participate in this, what we're calling a movement of movements. Today, to discuss health, we are excited to be joined by James Maskell, who is the founder of the Evolution of Medicine and host of the Functional Forum, and Kathryn Davis, who was producer and co-host of the Health Action radio program that was on Pacifica, the Pacifica Network, WBAI, and she is also the host and founder of Heart of Mind Radio, and she is a Qigong teacher. So let's start with James Maskell. So James Maskell is founder and CEO of Evolution of Medicine at goevomed.com. That's GOEVOMED.com. And he is the host of the Functional Forum at functionalforum.com, which is the world's largest integrative medicine community. He is on a mission to create structures necessary to evolve humanity beyond chronic disease. He lectures internationally and has been featured on TEDx, TED-Med, and HuffPost Live. He is also founder of New Health, which is spelled K-N-E-W Health, a payer solution for chronic disease reversal. Welcome to the 11 Days of Global Unity TeleSummit, James Maskell.
Rick, it's great to be back here with you. Yeah, welcome back, I'd say, a few years later. Thanks, great for being here.
Exactly. It's been a few years since we last were on the TeleSummit series together. So the big picture, as I see it, is that we have a chronic disease health crisis in the United States that is being exported around the world. According to the Centers for Disease Control and Prevention, diet-related chronic diseases and conditions such as heart disease, stroke, cancer, type 2 diabetes, obesity, and arthritis are among the most common, costly, and preventable of all health problems. Recent statistics show that about half of all adults in the United States alone, and that's upwards of 115 million people, have one or more chronic health conditions. 1 of 4 adults have 2 or more chronic health conditions. 86% of all healthcare spending is for people with 1 or more chronic medical conditions. And the total costs are staggering. The costs of heart disease and stroke are more than $300 billion per year. Cancer care costs are more than $150 billion per year. And the total estimated cost of diagnosed diabetes is over $240 billion per year. So James, is there anything else you'd like to add to the big picture of health in our society? And please talk about your work that you're doing with functional medicine to support healthy people and a healthy planet. Maybe you could start by telling people what is functional medicine?
Yeah, so Rick, I mean, this is a lifelong mission for me to transform healthcare and health outcomes. Ultimately, you know, this is a global summit, and just like you said, we are exporting it in America. We're about 30 years ahead in America and sort of sending it outwards as other countries follow our pattern of industrialization of the food system and also just sort of work cycles. Yeah, so functional medicine is an operating system of care where the goal of the care is to get people off medication and get them better. And ultimately, you know, the medicalization and the sort of drug first approach for chronic illness, which is very effective for acute disease and did a lot for humanity in the 20th century, is really not working. And ultimately, you know, we're in the process of still exporting that strategy to other countries. And so, you know, my first job was to kind of popularize functional medicine, try and make it cool for doctors to want to practice in that way. And now we've really shifted our focus in the last couple of years to provide, you know, models of delivery of that kind of care that can make it available to everyone, the most vulnerable, the poorest in society, and the most tech illiterate. And so, you know, it's a multi-stage plan, but ultimately, since we've last spoken, we've really been focusing in on, one, how to deliver that at scale to the masses, and secondly, how to pay for it and how, you know, how health payers can pay for it.
That sounds fabulous. So you want to give us more details and also maybe give a little bit of background. How did you get into all of this? You know, I mean, what made you decide to jump into this whole field of?
Well, I was actually the weird kid that was grew up on this medicine. I was actually born in a commune in America in 1980. I was born in Loveland, Colorado, in a spiritual community, and this was just the way that healthcare was growing up. And I didn't really realize that that was not normal until I went to school, and I was the only kid whose mum insisted that, she be contacted before I be given antibiotics. Right? And antibiotics is the perfect example of what I'm talking about, where, to fight infections in the 20th century, change the lifespan of humans, significantly. However, we're now at a point where the overuse of antibiotics is like a significant threat to global health. And so ultimately, I just had an inkling when I was 25. I sort of had a moment of clarity that something about the way that I was brought up in community, with natural health as the sort of, the way that people took care of themselves could be a solution to the world's most vexing problem, which is chronic illness. And so that was 15 years ago. And, over time, I spent the first 7 years really looking to understand the industry, understand, how health was delivered, what doctors did, what range of practitioners did, how people accessed healthcare. And then the last 7 years, really, we've been focusing on, trying to create a solution. And ultimately, we started with doctors themselves because it's a huge problem. To change the culture of a whole country, of a whole planet towards health is no mean feat. And so you want to start with something manageable. So we started first with doctors, in private practice in America and all around the world. We have meetups on 6 continents. So the focus was first to make it, accessible for those doctors to learn about this new way of treating patients, because most medical school is kind of paid for by pharmaceuticals one way or another. So we had to sort of make it accessible for doctors to find out about it. So we've made 68 shows of the Functional Forum every month for 5 years and continuing to build that community. But as I said, the real focus, since the last time I was on this TeleSummit is now thinking, how do we get this to not just the sort of richest, 20% of the population or 30% of the population, but actually how do we deliver this lifestyle first root cause approach to everyone?
Yeah, that's fabulous. So, are you seeing a shift happen in the culture, in the caregiving culture, the culture of doctors and hospitals?
Well, let me tell you a really, really exciting story, because I think this will get everyone jazzed about where things are going. So, if you're in healthcare and you're looking for beacons of light, a lot of people pay deference to the Cleveland Clinic, right? Very well-known medical institution. So on the 4th ever episode of my show, and I think maybe Kathryn and Rick, maybe you were there when this happened, but this was back in 2014, Mark Hyman came on the show and announced that the Cleveland Clinic was going to be starting a center for functional medicine. And so they started and they got going, and Mark Hyman was there trying to reverse everyone's chronic illness, and it was going pretty well. But what happened was the demand for this care, because it was available on insurance and it was being delivered through the Cleveland Clinic, just shot up through the roof. And the supply was not really keeping up with this demand. And so an administrator there by the name of Tawny Jones, who is a lifetime administrator there at the Cleveland Clinic, she decided to try a new way of making this care accessible to the masses. So what they did is they dangled Mark Hyman and the doctors at the end in front of patients, and they said, hey, go through a 10-week, 2 hours a week, available on insurance group visit called Functioning for Life. And this was run by dietitians and health coaches and PAs. And in that 10 weeks, they were introduced to a healthy community of people that wanted to get healthy. They were infused with these lifestyle behaviors of sleep and food and exercise and stress reduction. And at the end of that, having run this for a couple of years, 66% of the people who come through that 10-week group visit no longer need to see the doctor, because they're just better. They're off medication. They're on their way to health. They have a supportive community. Insurance is paid for all of it. It's profitable for the clinic. And so ultimately, you're going to see later this year the announcement of Functioning for Life. And it's in my next book, which is called A Cure for Loneliness. And really what we see is that by putting groups of people together and infusing healthy behaviors into that group, you really make this kind of care not only affordable and accessible, but actually, if we're going to build medicine on the back of behavior change, on the back of consciousness creation, ultimately, taking action from a new story, a group is a much more efficient delivery mechanism than just one-on-one care, and it's much more affordable. So that, that story by itself, like when that comes out, when the Cleveland Clinic gives its stamp of approval to a way of taking care of people that's about community, that's about connection, it's really transformative. And already they're starting to deliver that kind of care into, sub-clinics in the Cleveland area, churches, and, it's really transformational.
Wow, that's very powerful. And I remember when I used to go to your monthly functional forums, that you had some graphics about like the holistic approach to healthcare for an individual, and part of that would include group visits. And this is a concept that I don't think many people understand. So I wonder if you can go into it a little bit more about the dynamics of how it works, and how people, when they share their stories in the same room with other patients, what that can actually mean for an individual's healthcare, and also for the doctors themselves. How does that work? Are there more than one doctor in the room, or is it one doctor? Just how does that all work?
So there's lots of different models. It's really exciting, actually. In my book, Cleveland Clinic is one example. So that's, one billable provider, like a physician's assistant, one non-billable provider, which is like a health coach. The benefit of the dynamics, like people are more vulnerable in front of a group, especially if you have a group of people where there's different stages. This has been done in replicated in brain health, in, hormonal health, in, sugar balancing. There are amazing examples. Once I started researching all the different ways that group visits are being used, super exciting. But to me, the most exciting models of this delivery are a peer-based system. Because ultimately, the thesis that I'm coming to is that by leaving health creation in the context of disease care professionals, licensed disease care professionals, we have limited the potential of people helping each other to get healthy. And if we really want to create a big movement, worldwide movement around health creation, we really need to focus on peer-to-peer health delivery. And so another example in my book is this organization called Open Source Wellness, based in Oakland, California. And this is where you go through a similar 16-week process. Every week you focus on the healthy behaviors, and you actually do them in the 2-week session. So meditate, you exercise, and you eat in community every week for 16 weeks. And at the end of their 16 weeks, people can start their own group called Open Source Wellness X, like TEDx. And so you see that there's a 16-week cycle from learner to teacher. And that has the hallmarks of a really exponential movement for health creation. And so, the answer, Rick, is that there's really power in the group dynamic, that, we're really right at the beginning of understand how to do group medicine. But ultimately, vulnerability in a group is much higher because people will be more honest with a group of peers who are going through the same thing than with any sort of health professional. Two, it's much more like affordable for the people to go, because let's say you want to do community acupuncture, one acupuncturist time divided by 20 people suddenly makes it very affordable, for those kind of therapies. And then, the behavior change is much easier in a group. And ultimately, we need a lot of behavior change really quickly. We can't out-drug type 2 diabetes. And so creating, structures where people can support each other to change, that's the future of medicine.
Wow, that sounds amazing. And I'm just curious if the mainstream, let's say, insurance industry is actually supporting this, and of course that's all tied into what kind of healthcare system we're going to have in this country, which I want to get into when we have our kind of roundtable later. Like, we have all these things on the table about Medicare for all and all this. How do these kinds of forward-thinking practices fit in currently with the mainstream, insurance and all of that?
It's a good question. So, the things that stop functional and integrated medicine from being available on insurance, right? That it's inefficient, it's not profitable to deliver, It's like focused on non-standard of care modalities. These are all reasons why it hasn't been paid for by the current system. All of those things disappear when you're doing groups, because Medicare will pay for it, Medicaid will pay for it, commercial insurance will pay for it, people will pay for it out of pocket, because they want that community. And yeah, I mean, over this process, Rick, I've become super enthused about this movement. And the next book and everything that I'm doing is to try and make group visits cool. But ultimately, we're not going to wait for medical institutions have an opportunity to start to deliver this in the system. And the next book is really to try and make, instead of making, these doctors the heroes, let's make that administrator at the Cleveland Clinic who worked this out. She's like, just a lady who worked at the Cleveland Clinic for 50 years. She's a beautiful soul, really understood what people needed and created this system and has maybe, sort of created the thing that changes everything. But ultimately, we want to go after people themselves. Like, it's people who are suffering, right? It's easier than ever to organize with the internet. And so I think that leaving this in the hands of the disease care system is not going to cut it. And so we want to create tools for people to really go out and do this themselves. So I'm very enthused about it. I think payers are very enthused about it. And I'm excited to see where the future will take us.
Wow. Yeah, that sounds great. And I'm sure that when we talk about media, especially with Kathryn Davis, that's going to be an important piece of it, like bringing these kinds of ideas and what's happening to the public awareness is a big piece. But anyway, why don't we bring in Kathryn Davis to this conversation. Why don't you go ahead, Karen, and bring her.
That would be my pleasure. Kathryn is so amazing. She's a producer and the host of Heart of Mind Radio since 2000. And heartofmindradio.com, her shows broadcast on WBAI, Pacifica Radio, and PRN, which is Progressive Radio Network. And she also is a Qigong meditation movement teacher and a spiritual doula and a vibrational healer. And she's also our amazing, beautiful messenger for the 11 Days of Global Unity, leading our message of health. So Kathryn Davis, what a blessing to have you here with us. One of the first questions, oh, thank you so much for being here and taking the time to be here with us. We so appreciate it. One of the big questions is exactly how did you get involved with this, with healthcare and with using media to help bring this message to the masses of the importance of our healthcare systems?
Well, that's a long story, but I'll start with how I got involved with healthcare, primarily as a healthcare taker. My mother had multiple sclerosis, so I grew up taking care of her. I think she was diagnosed when I was about 8 or 9, maybe a little earlier. So I saw directly how little the medical system could do for her. And in fact, there was kind of a prejudice against giving her appropriate care because their position was, well, we can't cure her, so we're not going to pay attention. And so after going through that experience, I began to lose faith in the medical system. And I looked for different kinds of alternatives. And I discovered alternative medicine, and I discovered how eating healthy was important. And I did that primarily through media. So my first approach to media was as a listener. And I learned about how I could keep my body healthy. And one of the things I realized is I actually grew up in what might be categorized as a ghetto area in the South Bronx in New York. And I realized in retrospect that I never really saw a live vegetable till I was a teenager.
Wow.
All we had were frozen packages and things like that. And so I really started by educating myself by listening to other health programs. And through that, I became more inspired to get involved because I saw media as a way of reaching out to a much broader audience. And I became eventually a producer at WBAI Radio in New York, and the focus was primarily complementary alternative health, but also a lot of politics and policy. So I came into it back during an era when doctors were being arrested for alternative medicine, and there were a lot of laws against even being able to offer these services. So I became involved as an activist. And in New York City, we got the New York State Alternative Medicine Practice Act, I forget the name of it now, that would protect doctors so that they wouldn't be arrested for offering these services. And then I would interview people and bring them on the air and try to educate people about how to take care of themselves. And in my own process, I discovered that underlying a lot of my own health challenges was this issue of stress. So that's how I got into the movement and the meditation and the practices of Qigong. So now I do that as my practice. I teach Qigong, I do energy healing, and I continue to try to bring out the message that people can be self-empowered and how they can heal themselves. So that's kind of the nutshell of it.
I just love that, Kathryn. Thank you so much for all the work that you're doing in the world. What a blessing that is. Now, you've spoke about Qigong, and you are a Qigong practitioner and a healer yourself, correct?
Correct. Qigong is a derivative of traditional Chinese medicine, and it is very similar in the way it looks to Tai Chi, except that with Tai Chi, it's more patterned after martial arts. The movements are more external. With Qigong, it's more patterned after medicine. So you're actually using your focus to move the energy within the meridian system to work with the acupoints and chakras or whatever it is that's happening internally so that you can maintain your health through those practices. So it's stress reduction, breath, movement, meditation, and this gentle flowing movement that allows us to not only keep our bodies healthy, but give us the strength and energy that we need to move through the world.
And that sounds like it can reduce stress as well.
Absolutely, it's a stress reduction exercise, and it's in many different stages. So there are practices for beginners, practices for people who are intermediate, and then you can master the whole process and become a teacher or a healer as well.
Right. So one thing that I've heard holistic health practitioners talk about over the years is this concept of the standard American diet known as SAD, SAD, and yet our mainstream media doesn't really talk about this at all. We see drug commercials dominating the airwaves. So do you want to talk about the role, Kathryn, the role of media in individual health as well as societal health, and what do you do to accomplish
Right. If you're talking about mainstream media, it doesn't help actually, because it's all about commercials and marketing and getting people to buy products that are in many ways poisonous for them. But I do believe that the alternate media, I guess you would say, the internet is one source, and stations like the ones I work with, which are independent of commercial advertising, and they're really out there to give you the truth and to share, that it makes a tremendous difference. And at here at WBAI Radio, we've done a number of health initiatives where we come together as broadcasters, but also healthcare providers, and nurse practitioners, doctors, and we create initiatives for our listeners so that they can go into a program and get advice and learn what testing to do, learn how to meditate, and really very much like what James was talking about. We've done that a number of times and we continue to do that. So maybe I should check out what he's doing, because really it's through the media that we can empower people to take those steps. And also, like, it is really important to have that community effect, because it's very difficult for people to do it on their own. And also, everybody has sub-issues that they're dealing with. So it might be depression, it might be some other thing that's going on that is preventing them from moving forward or somehow propelling them into a self-destructive behavior. So all of those things have to be dealt with. And with media, what's good about it is that we can come to the listeners and take apart each of these elements with various guests and allow them to educate themselves and get access to the different resources that will make a difference for them. But I do think the non-commercial alternative media is primary in being able to do that. I don't find it so much on the mainstream, though you find pockets of it there.
Right. It's probably a matter of the more corporate interests beginning to see the writing on the wall, and then going with it as shifts starts to happen. We've seen that in the past. But one of the when you were talking about the importance of community, Kathryn, it seems like this idea that James was talking about with the group visits can have the effect of also letting people know that they're not the only one that's going through a particular thing. Sometimes part of the problem is that people sort of blame themselves for, what's happening, and they think, it's happening to them alone, but the group thing can probably help, right?
I think that that's true, but there's also what's not always taken into account is the social stress. So I like our radio station because it does have that reach into anybody's home, providing they have radios or internet, but they don't have to pay for cable and such. And also, I think there's a problem with access to care. So I'm glad to hear that this is now, in some fashions, acceptable by Medicare and Medicaid, but the majority of people that you're going to find in really poor neighborhoods are under stress for housing, are being gentrified out of their neighborhoods. They're under stress for not having even access to good food, much less knowing what to choose. There's the stress in the schools where they're selling hamburgers instead of vegetables. So people who are at a level of poverty that goes below the line of what even we might think of as Medicaid, Medicare, because the access to that is fairly limited, really. And so I think that there needs to be some kind of communication that really can go into communities where they are and help them that way. So I think that there's still a need for that.
So what do you think about that, James? How does the model and what you're working on, how can that be adapted to people in those communities like Kathryn was just talking about?
Well, the first thing I want to say is I think that the widespread growth of Qigong into communities around the world could be like the healthiest thing that could possibly happen. My business partner, Gabe Hoffman, was a huge proponent. One of the things that I love about Qigong is that the barriers to entry is basically zero, right? Even if you're in a wheelchair, you can sit there and you can move your, the Qi around and whatever. So, zero barrier care is what we need. Right, and getting groups of people together to do Qigong, you can do it anywhere. Like it includes stress reduction, it includes mindfulness, it includes exercise. You know, it's a lot of these things together. So I think it's an amazing starting point. Yeah, look, I mean, ultimately, Medicare and Medicaid is kind of the lowest rung of where care is delivered. One of the reasons why I'm excited about, you know, group visits as a solution in the medical system is because ultimately these people who are under social stress, they end up in the medical system. That's where they kind of end up being. And you see like the CEO of Kaiser Permanente talking about we need to access the social determinants of health. And so there's a big push, you know, for organizations to recognize just what Kathryn was saying, is that, you know, the biggest determinants of health are, are social, and these social stresses make a big impact. So yeah, I think that this has potential. I think, you know, we can do it through the medical system, but ultimately what I could see is empowered peer leaders. Like if you look in these kind of communities, there are typically, you know, pockets of people who, you know, who have realized vegetables are really important for health and have started, let's say, a little urban farm, you know, using those kind of centers of health creation and creating sort of, you know, movements where the first group of learners become the next group of teachers growing out. There's really no barriers to that either. And I guess the thing that I want to say, just with regard, you mentioned Medicare for all, Rick. You know, 2020 is going to be a year where, as a population in America, we decide in healthcare whether or not we want the market-based solution, which is like Trump, which I just want to be clear, like some of what Trump has done in healthcare is not crazy, right? In situations where you have one insurance company that can operate in one state that has a monopoly across the whole state, you know, to allow competition between insurance companies actually, you know, is kind of sensible in a reasonable way. Like some of what Trump has done, even making things like direct primary care and medical cost sharing, you know, tax deductible, some of that is not crazy and actually makes sense, because what we had before is kind of like disgustingly oligopolistic, basically, right? But then on the other side, you have Bernie and Elizabeth Warren, who are like, hey, Medicare for all. And so we have this dichotomy where it's like, should the market solve healthcare or should government solve healthcare? And ultimately, you know, my feeling, and this is not just my feeling, but I've been reading a book recently called The Third Pillar by an IMF economist. And he's like, look, what we're forgetting is that there's this third pillar. It's not markets and not government, that's community. And community has been destroyed by technology. Right? Whatever, over the last 200 years, it could be, you know, neighborhoods destroyed by otherwise. And ultimately, it's only by strengthening this third pillar that we solve these problems. And my feeling is that group visits are like the personification or the actualization of the strengthening of the third pillar. And that ultimately, you know, this is the way that the community starts to take care of itself. And how will it be funded? We'll have to look, you know, at how that knows. But communities, those communities that Kathryn is talking about, they understand the problems better than government, right? Markets is not really a solution when no one's got any money, right? But community can be that third pillar. And so I'm really excited to be sharing that message in 2020, because ultimately I feel like both sides of the debate can agree that communities need to be strengthened, and hopefully it'll just be the right news at the right time that could maybe be, you know, a message that can bring both sides together in a very, you know, ultra polarized world.
I really like that, and it sounds like that can fit in with what you were saying, Kathryn, about the communities that have been kind of losing hope about those other two pillars, and you know, government and markets, and maybe how they can begin to come together themselves to have this kind of peer what would you call it? Peer delivery of health?
Yeah, I think that you know, I'm excited about what you're talking about, James, actually, because I see it as just expanding on what I have tried to do and would love to do more in the future. So I totally support it. And it is true that we do have that need for community support, but I don't think it could absolutely function in isolation, because it doesn't take into account the homeless population. It doesn't take into account people. Like I passed by a social services office, and I went into this office, and you see crowds of people just sitting there waiting and being abused in a way, not being addressed. To me, that's the place to start having some kind of community gathering for help or for self-care. But it would need to be institutionally supported to be able to do that. I can't just walk in and start gathering people into a meditation. But I think that, so there does need to be some cross-pollination there to sort of break down the sort of hostile attitudes toward the poor that is taking place in our institutions today, where people are demoralized and abused and made to feel like trash and don't have any access to the kind of resources that will make a difference. So I'm agreeing entirely. I'm just saying that there needs to be some interface with policy to make it possible to go into a homeless shelter and work with people, go into a welfare center, even, go into a hospital waiting room, a place where you're going to actually interface with these people. I think that it's necessary not to forget that people at the lowest rung of access.
Yeah, just to follow on with that, Rick, I would just say, I completely agree with that. And you can see how the medicalization of health creation has created a structure where, people like Kathryn who want to go in and make a difference are actually stopped from doing that because, they're not a licensed healthcare professional doing things. Now, look, we created, the reason why I called my business Evolution of Medicine, right? Medicine was created in an era of acute disease, and you needed experts at that time, right? You needed experts because giving someone the wrong drug, right, could be a life or death scenario. But someone, Kathryn going into a center and teaching people Qigong, the worst case scenario in that situation is zero. Like nothing could, even if they don't do the Qigong right, they're not meditating quite right, there's no downside risk at all. And so ultimately, this is what I was saying about taking back health creation from the healthcare system, because that system wasn't created to create health. And it's done a horrible job. In fact, health creation has been maligned and pushed to the side. And even, providers that were focused on health creation, like naturopathic doctors, not licensed in most states or otherwise. But that's really because we've been trying to acquiesce to the system. And ultimately, this is more like a people's revolution, honestly. This is more like people, finding ways to be able to, take what they've learned, teach to other people. And if you're talking about the fundamentals of health creation, stress reduction, social determinants of health, sleep, dealing with food and those kind of things, this is something that I hope that we will see, people breaking the shackles of the rules and just getting on with it, because we've got a big problem to solve.
Yeah, one of the things that was striking me as you were talking about the idea of group visits and that kind of thing, it seems almost like an analogy to what some people are proposing and pushing in the world of work, and I guess the movement is called the democracy at work, where the idea is to promote worker-owned enterprises, where all of the decisions are made by the people who are doing the work of these enterprises, and some of them are very large in the world. Like there's a place called Mondragon in Spain, which is pretty gigantic, and it's got hundreds of thousands of people working, and all the decisions are made by the people who work in these companies. So the idea of top-down hierarchical, money flowing to just a few at the top and not so much for everyone else. That kind of thing is changed when you have this concept of worker-owned enterprises. And so maybe what you're talking about with this community-based health care delivery can be an analog to that concept, and begin to make this shift away from the catastrophic hierarchy that has caused so many problems in our world towards the more community-based model.
Yeah, I look at it, and let's just be real, that is still necessary, right? We still need, if you get hit by a car, you need catastrophic care. Ultimately, what I'm saying is, like, let's just not have those same people teaching people how to eat vegetables, because that's not going so well, right? Vegetables, it can be the community-based structure. Meditation could be community-based. Sleep and those kind of things can be community-based. Ultimately, we have to find ways to fund that. But again, it's much more affordable when you're doing things in a group, because one health coach divided by 20 people, is, let's say the health coach is getting $40 an hour between 20 people. That's $2 per person per hour. Like, you can find ways to pay for that, right? There are, that you're stretching, either Medicare dollars, or you're stretching, community dollars to do that. And a lot of times, what you're talking about is people sitting in a room together and dealing with their problems as a group, right? This is just like an evolutionary priority, right? I was reading another book recently called How Healing Works. I think you'll like this, Kathryn. But he was by Wayne Jonas, and he was redescribing the placebo effect and really calling it what it really is, which is the ritual effect. Right? How we called this placebo, we think, when you think placebo, you think, oh, it's a trick. What the placebo effect is doing is what is the health creation that's created from the ritual, right? When a doctor and a guy in a white coat gives you a pill, if you get better and the pill doesn't do anything, that's the ritual effect. And ultimately, sitting in a group, talking about your problems is the most obvious and evolutionary, ritual that we have. Look at all the ancient societies, look at everything. It's sitting around a fire, talking our problems out, elders offering advice, people solving each other's problems. So ultimately, it's just really hearkening back to, taking back that community infrastructure and not relying on a system that's not created for what we're trying to do it, and not waiting for that system to adapt, because there are so many reasons that system doesn't adapt. There are financial reasons, there are ego reasons, there's humility deficits, right? And so, ultimately, the people that need the healing need to facilitate the healing. And, I'm super excited to see, peer leaders stepping into the breach and bringing their education to groups, and then seeing an exponential effect.
Would you say that that's the future of our healthcare systems and our community? That community will be the future of the healthcare and the healthcare for our systems in USA and globally?
Look, I think it's the future of health creation. I think that ultimately one of the things that we have to do is extricate our language, because ultimately all of the language that we use in health is a function of disease, right? You want to reduce your disease risk. Even words like healthcare, like that, just it's all tied into this disease care system that has been created. And ultimately, I feel like the language is really important, because if we can extricate ourselves and our language away from the system, then it's the first step in doing it. And that system is built on fear, right? That fear of disease. And ultimately, what I see emerging, and the thing about an emergence is you don't know really what it's going to look like, because this is grassroots, right? This is not a top-down, Medicare is going to pay for group visits, even though that is happening, right? The emergence is such that if we can take away the words that connect us to the disease care system and just actually step forward into self-actualization of this system, then that is the future. And it is coming one way or another. And I'm just basically hedging our bets. I'm not reliant on the disease care system to adapt to this, but I think that it's in the best position to deliver it, because that's where lonely, desperate, poor, homeless, whatever people end up somewhere in an emergency room somewhere. And there is money to pay for the care for those kind of people from the government. But ultimately, for this movement to have its, to reach its potential, it needs to be completely extricated from healthcare, the healthcare system, the disease care system that we use right now.
Yeah, and if you're talking about words, that's where I immediately think about media, right, Kathryn? I mean,
Yeah, it does come to media, but what was coming to my mind as you were talking, James, is like returning to some of the older traditional ways of being in the world, where a lot of what people suffer from are the stresses, the loneliness, the alienation, the separation is what leads them down the path of disease, and sometimes even into these extreme states of being homeless or whatever. It's because the community isn't there. There isn't the sitting around a kitchen table. There isn't the men's club or, the women's charity. That we don't have these organizations anymore. And people are very, very isolated. So I almost see what you're saying about bringing the community back to healthcare. It's almost like it would be able to funnel into an expansion of how people are living their lives in a very positive way.
And Kathryn, you have a public event that that you're going to be offering. Can you tell us a little bit about that?
Yeah, I think Karen's talking about an upcoming WBAI event on health.
Oh yeah, we've started another health initiative in which we're bringing people together to work on changing their diet. It's sort of focused on weight loss, but all the issues around it, the stress reduction, the movement, understanding the hormonal balance, digestion. So looking at the different elements that might be impacting people's health and bringing them together to work as a group. So people can connect with me through email, perhaps heartofmindradio@gmail.com. And also at WBAI, we're going to be doing, as a part of this 11 days, a program on really looking at the various healthcare issues that are coming to us from the various candidates. They vary greatly, and some of them are real and some of them are not. So we're going to be doing that also at WBAI, and that's important. And also, I am a teacher, so I'm available to teach Qigong.
That's great, and I'm glad you're saying that, because as we wind up, I want to ask both of you how people can get involved and support your work. So, Kathryn, you just gave a little bit of how they can get in touch with you through your email. You want to give that again, and also like a website where they can reach you?
Yeah, the best one to make that introduction is heartofmindradio.com or heartofmindradio@gmail.com, and everything else you can connect through there, either of those.
Yeah, that sounds great. And one of the things we're doing this year for the 15th anniversary of 11 Days of Global Unity is we're setting up special hub sections on each of the 11 themes where people who are doing amazing work in each area can connect and have greater visibility. So that's part of, the health one. We're in the process of launching that now. So it's very exciting. So both of you will be represented there. And James, do you want to let people know how people can connect with you and support your work?
Yeah, absolutely. So yeah, we, for health professionals, you mentioned evolution of medicine. For anyone, my second book is coming out in January, and it's called A Cure for Loneliness. I'm self-publishing the book so that we can give away the book to everyone. And ultimately, we can put this book in the hands of every hospital administrator, every Medicare center, every Medicaid center, so that people can just really that this thing can happen really quickly. We also, since I last saw you, Rick, I've been busy. We started an alternative to health insurance that's community focused as well. So it's 30 to 70% cheaper than health insurance. If you are listening to this and you're American and you're between the ages of 21 and 65, you can go to knewhealth.com. That's KNEW health.com. And we're super excited to suck people out of this disease care system and focus them into a health-focused system, but still have reassurance that if you get hit by a car, your bills are going to get taken care of. So newhealth.com is a great place to find what we're up to. And yeah, just really appreciate, all the work that you've done. 15 years, Rick, things have changed in the last 15 years. I'm not going to contribute it all to you or attribute it all to you, but certainly I feel like things are in a certain way moving in a good direction, even though obviously there are perfect examples everywhere of things going in the wrong direction. But I'm more excited today about the potential of the functional medicine movement through this group visit structure to really have an impact on the people that really need it the most. And so I really appreciate the opportunity to come and share.
Well, it's great to have you both. And Kathryn, thank you for hosting. Any final words?
I'm so inspired by both of you. I'm so excited to share this. And I encourage everyone who watched this to share this with your family and friends, and to take the time to really sit down with the people that you love and talk about this new way of thinking, because we do have this beautiful opportunity to have unity in our community. We're growing kindness and unity in each community, and every person makes a difference. So I love that we get to have these beautiful experts who can come in and really inspire us and uplift us. And that's what We the World is all about to me. I believe that we are, what we've been looking for. And when we inform, inspire, and involve, we become the we that we thought was missing in the world. So I'm excited for that. And Rick, can you close us out?
Okay, sure. And all this talk about community-based health and healthcare. Well, what is that? That's all about we, right? That's what it is, right? So as I always love to let people know, when we launched We.net and the We campaign, our dear friend Jonathan Granoff said, I hope that we expand so much that there is no longer any them. So thank you all for joining us, and you can again be in touch with us through We.net, where you can sign up your organization to participate, and also to join the We team. Just go to the homepage of We.net and get involved. Thank you so much.
Thank
Thank
you.
you, everybody. Bye, everybody.
Thank you.